with 5 kwacha. Not a lot. A 5 kwacha auto boost can get you 1,900 kwacha extra IO cover. Bernard Mulindu auto boosted, and Bernard received a total payout of 2,070 kwacha when he needed it most. Here is Bernard's story.
My name is Bernard Mulindu. I'm from Moto. Kairi Hospital Church. With a pipe on a problem 296 cash. Ngasanya kwa chat. Wametumira kwa 2 Kaya manda kusongera tukara mukurazichi yakura tawole bomba. Alipira kwa nabana ku masuku. Aba balipigwa wale bombenchi. Wale bombenchi tulisuma sana.
Dial *296# to auto boost and quickly grow your IO recharge with care cover each time you recharge. IO together with MTN. IO, because you care.
Good evening and welcome to today's discussion. Like we promised you, today we have been joined by a cardiologist, and it's not every day that we have such experts around, and I'm hoping that going forward, she will come back and join us. So very quickly invite somebody, tag someone, share this link as wide as you can, because we need everybody to be able to get this information, because this is valuable information. We have very few cardiologists in the country. If I'm not mistaken, there are less than 5 the whole country. So to get one on this program is a very, very exciting moment just for me, and I'm also excited for you. Without wasting time, let me introduce you to our guest for today, and this is none other than Dr. Loretta Kawe. Doctor, welcome.
Thank you so much, Dr. Mjajati. Thank you for inviting me, and good evening, everyone.
Right, so we are joined by quite a number of people. So those of you who have just joined us, as usual, please tell us where you're watching us from. We are quite interested to know, as usual, where you're watching us from. So, Doctor, do tell us, introduce yourself, first of all. Who is Dr. Kawe?
Okay, thank you. I am a consultant interventional cardiologist. Right now, I'm working from the newly opened National Heart Hospital. It is a government hospital, and it's designed specifically for cardiac patients. It's located off Airport Road. I'm sure you know about it soon. I was trained as a medical doctor from the University of Zambia. That's where I did my medical training. Thereafter, I did my MMed, which was a specialization in internal medicine from 2011 to about 2014. In 2015, I decided to then go for further training. I went to Cape Town, where I trained as a cardiologist. I was there for 3 years and came back in 2019. From there,
Right.
I was attached to UTH. So I was working for from UTH from 2019. And then this year, I was moved to National Heart Hospital.
Right. So now tell us about this National Heart Hospital. So this is a hospital purely dedicated to treating people's hearts. Is that what you're saying?
Yes, so it will be a purely cardiac hospital. We'll treat both medically and surgically. So we'll have both clinical patients and those that require what we call interventional cardiology, which is my field, and those that require open heart surgery. Right. So it will basically tackle all sorts of cardiac illnesses, the advanced kind of illnesses that can be dealt with at any other place. So it will be the main referral center for all advanced cardiac illnesses.
Okay. So let me put you a bit on the spot here. Are we seeing the possibility that we'll soon stop sending patients abroad for heart conditions?
Yes, very much so. We have the expertise, and we have the equipment as well, most of the equipment anyway. So obviously, we can't eliminate sending patients abroad altogether, but the number will drastically reduce. Maybe only about 10% will be sent out. And that's purely because we might not have certain equipment that are required to treat certain conditions. But we hope with time, we are going to be fully equipped in terms of anything that we need to do on a cardiac patient such that we won't need to send anyone outside.
Right. Excellent. So, having introduced yourself, let's get into today's conversation, Dr. Kawa. Today, you are going to tell us about angina. You are also going to tell us about heart attacks. And as we get into this conversation, I believe you have some slides to share with us. So kindly share your slides so I can put them up as well.
Okay.
Okay.
You can see the slides?
Yes, Dr. Kabo, you can proceed to tell us about angina and heart attack. And I hope that the people at home are paying attention. And let me make special appeal to particularly those of you who are training as health workers. You may need to really get out your pen and paper and take notes. Rarely do we get such a presentation on this platform. And if you are hearing about this information for the first time, don't worry. I know Dr. Kabo is a very good teacher. Even if you've never been to medical school, this topic today will be made very, very clear for you. Dr. Kabo, please go ahead.
Thank you so much, and welcome to my lecture, everyone. So today we'll talk about what angina is, and I'll try to explain how you differentiate that from a heart attack. I've got a few slides to share with you, so just follow along. Okay, so let's start with angina. I'm going to tell you a little bit of about where the heart is located and what happens when someone has angina. So the heart is on the left side of the chest. It's supplied by special types of blood vessels. We call them coronary arteries. Now, what happens is in these coronary arteries where the blood is passing, the arteries that supply the heart, sometimes you can develop certain things in there. We call them plaque. Okay, what you're seeing here with my pointer, I hope my pointer is clear. So you develop plaque within the vessel, and this is the plaque that causes narrowing of the vessel. Because the vessel becomes narrow, you don't get enough blood going beyond that plaque, such that the heart sometimes starves of oxygen. So angina is describing a condition where you get chest pain because part of your heart muscle is not receiving oxygen because you've got plaque inside the vessels that supply your heart. Okay, so now I want you to pay particular attention to this picture. The heart has three main vessels. So usually when we do certain tests, we see these big vessels you're seeing here, the big ones. But you should realize that it has a big network of small vessels which supply the inside muscle of the heart. So these small vessels can equally get sick. The same way the big vessels get sick, the small ones can get sick. What I've noticed here, most patients in Zambia, is it's not usually the big ones that get sick, it's actually the small ones that get sick. And it can cause the same type of chest pain that the big vessels can cause. We'll talk about all that. So now, what triggers this type of chest pain? Most of the time, it's physical activity. For someone who's predisposed, obviously, to angina, meaning they've got plaque inside their coronary vessels, when they exert themselves, they get chest pain. I'll describe what that chest pain looks like. Emotional stress can also trigger it. Sometimes if you hear someone say, if I move through a cold wind or when it's very hot, I get this chest pain. After a heavy meal, it can also happen, obviously, because most of the blood has gone to the stomach and you sort of starve the heart of oxygen. Excessive alcohol intake is a problem. Cigarette smoking is also a trigger. Illicit drug use, even one shot of those drugs. I know we don't talk about it a lot in Zambia, but it's quite common. Cocaine, heroin, all those drugs can trigger a heart attack very quickly and angina pain as well. What are the risk factors? So, commonest in our country is hypertension. Hypertension shouldn't be thought about as a white people disease. It's actually an African disease. It's very common here. What happens is when you are hypertensive, essentially the heart is working against the pressure. You know what happens to you when you're in a gym? Look at this. and look at this. When you're in a gym, obviously when you're lifting weights, the muscle grows. In hypertension, it's like the heart is in the gym all the time. So the heart is pumping against the high pressure all the time, and the muscle becomes thick. Outside, in your arms and in your legs, it's okay to have thick muscle, but in the heart, it's a problem because it affects those small blood vessels that I showed earlier. Those ones become deformed and they don't work properly, and you can get angina pain in addition to destroying the big vessels that are outside. So hypertension is the commonest risk factor in our setting. Your normal BP should be at least around 120/80. We can allow anything below 140, but 120/80 is ideal. Diabetes is another common risk factor. When you have high levels of sugar in your blood, it causes a lot of changes that promote formation of that plaque that we talked about in your blood vessels. So diabetes is also not good. High cholesterol, third risk factor. After the age of 45, everyone should at least get one reading of cholesterol once a year. Okay, cholesterol is what constitutes the plaque that I talked about. That's what forms the plaque. So high cholesterol is a risk factor for angina. Smoking. Cigarette smoke contains a lot of chemicals that not only injure the inside of your blood vessel, but also promotes inflammation. Let me spend a little 1 minute or so talking about Shisha. It has become a quite common practice, especially our young ladies. You find them smoking a lot of this. Shisha contains the same chemical that you find in ordinary cigarettes. See, Shisha, in addition to what's found in the ordinary cigarettes, the little charcoal they put on top of that bong, that one, the combustion is not complete. So what you're essentially doing is breathing in a lot of carbon monoxide in addition to the other constituents that you're breathing in from the nicotine, the tar, and everything. And then the amount of smoke you breathe in compared to one who's smoking an ordinary cigarette is almost 150 times higher. So smoking shisha is not protective at all. Smoking shisha is as dangerous, in fact, can be even more dangerous than smoking the ordinary cigarette. So in terms of angina, cigarette smoke destroys the inner lining of your blood vessel, and it can cause plaque to build up as well. Obesity, quite common in our setting. Obviously, if you're obese, you're predisposed to having high sugar, you're predisposed to having hypertension, and you're also predisposed to having high cholesterol. And that is a recipe for forming plaque inside your vessels. Family history, of course, that you can't change. It's very important. So you should ask around and find out if there was anyone that had, for instance, died of a heart attack, or if there was any sudden death in the family, or there's just heart problems in the family. That can indicate that you may be at risk of having certain types of illnesses. If it's heart attacks, maybe some families are prone to having high cholesterol. They don't know about that. So having a family history of people with heart problems also puts you at risk. Talking about gender, males are more at risk of developing angina or coronary artery disease compared to women. Any male above 50, but obviously it equalizes. When a woman reaches the age of 65, that risk is the same. Okay, so those are the common risk factors that predispose you to developing plaque and then consequently develop angina. So what symptoms do you get? The classical description of angina pain, which you should remember is chest pain because your heart is starving of oxygen, is pain in the center of your chest. It usually occurs behind your breastbone. In terms of description, it's described as a heavy type of pain. Sometimes it can feel like a burning pain. Other times it's sharp, and it likes to go to the neck and behind the earlobes, sometimes the upper back, and commonly down the left arm. Sometimes it can go down the right arm, but not so common. Yeah, so if you see this description, that can be classical of angina. And how it comes is someone usually exerts themselves, then the pain comes. When they rest or they take medication such as nitroglycerin, the pain goes away. That's a classical description. So you can't have angina if the pain is lasting the whole day, 2 days, 3 days. That can't be angina. Otherwise, by that time, your heart would be damaged. So angina pain is very classical, comes with exertion and goes away when you rest or you take some medication. Other symptoms of angina can be unexplained shortness of breath, like unaccustomed shortness of breath. You're doing simple tasks and you're excessively short of breath. Tiredness can also be a sign, especially in women. Most women and sometimes diabetics come with what we call atypical symptoms, symptoms that are not common. Okay. Some people get what is called stomach pain or epigastric pain. This is pain just where the stomach sits. Sometimes it can be confused with reflux, but again, like I've said, the pain of angina comes and goes, comes and goes. It's never constant. If it's constant, then you're looking at something else. Then it can also come as unusual excessive sweating. You just walk a short distance and you break out into a sweat. That is of course, it can be associated with other symptoms as well. That can also be a sign. And then lastly, some people can have like near fainting episodes or can have palpitations as a manifestation of angina. So it's got a lot of faces, but typically people come with chest pain the way I've described it. How do we diagnose the pain? When you come to the hospital, obviously, we are going to take your story. The story is very important. That's what makes up 60% of that diagnosis. After the story, then we go ahead and do certain tests. We start with an ECG. An ECG shows us a lot of things. An ECG is essentially an electrical picture of the heart. When the heart is starving of oxygen, it changes the ECG in a certain way, so we're able to tell. If the ECG is not informative, we get a subjective assessment of your chest pain. We put you on a treadmill and then we do the ECG as you exercise. Remember what I said? When you have angina, the pain comes when you're exerting yourself and it goes away when you rest. So when you put someone on a treadmill, the angina can manifest and we are able to tell how serious it is. There are those that are very high risk where they require certain types of treatment immediately, and those that we say, okay, you can do with medication, so we'll leave you alone on medications. If we fail to get anything on the ECG, we can go ahead and do other advanced tests like stress, echo, and so on. Okay, so now coming to the treatment. If you have that type of illness, remember angina is coronary artery disease and it's a chronic illness, just like hypertension and sugar. It has to be maintained in a certain way. So in terms of symptoms, we give certain medications. These are the commonest ones. Nitroglycerin is a type of medication that we give. Either you take it under the tongue as a little tablet or you spray under the tongue. Sometimes we can give you a tablet that you take and swallow with water. So what nitroglycerin does is to make the blood vessels that are surrounding the heart and the small ones to become a bit bigger, to dilate so that more blood passes through. Then in addition to that, we can also give certain drugs called beta blockers. These ones reduce the oxygen consumption of the heart. So that also helps with reducing your chest pain. A caution for men that are on these tablets, it's important to inform your doctor that you're taking these tablets, because if we give you this in addition to the nitroglycerin, it can drop your blood pressure okay, that word. It will drop your blood pressure very much, such that you fail to, it can result in complications. Your blood pressure can drop so much that it can induce a heart attack. So whenever you have angina and you take these tablets, please inform your doctor so that we give you an alternative tablet. Obviously, we can't mix this tablet with the nitrates. So please make sure that your doctor knows. Okay, so what do we do if the angina pain is not going away? So after medication fails, then obviously we need to mechanically take care of that narrowing in your vessel. If you look at this vessel here, there's a little bit of a narrowing there. So this patient came with a similar type chest pain, the medications failed, so we had to go into treating him now with advanced means. This is a cath lab where we mechanically treat the angina pain by putting in a stent. Okay, so how do you prevent angina? How do you prevent coronary artery disease? Like any other lifestyle illness, you can do certain things to reduce, one, the risk of developing that plaque or its progression, and two, from developing severe symptoms that can damage your heart. Obviously, we want to lower any of those other risk factors that can promote angina pain. Blood pressure has to be treated. I've already talked about the number. Your blood sugar has to be lowered and your cholesterol has to be controlled. Please take your medications as prescribed. But in addition to taking your medications, it's not enough just to take a pill. You have to do something also to help us along, which means maintain a healthy weight, stop smoking. I know it's difficult, but it has to be done because there are no two ways about it. Cigarette smoking is not good for you. And then take up an exercise routine. You don't really need to go in a gym to exercise. It becomes a bit difficult. You see all these fit people exercising, then you're going there the first time. It can be a bit intimidating. So whatever you can do to manage, you can manage to do. You can take walks. If you're able to run, you should run. You can download some YouTube videos and do yoga, Pilates, all those aerobic things. If you're a swimmer, it's warm now, you can swim. So anything that you can sustain. The message is take up an exercise routine that you'll be able to sustain in the long run. Because if you start like very fast, you'll be tired within a week and then you stop. So it has to be something you sustain. And then, of course, your diet has to be good. The message here is everything in moderation. You know what the bad foods are, the fried food, the sugars and the chocolates and everything. You have to choose healthier options and then limit on the foods that would precipitate these other illnesses. Of course, we are not telling you to get rid of everything, but do it in moderation. Okay, so that was it about angina. Then we go into a heart attack. A heart attack is not is a emergency condition. Of course, there has to be a precipitant. The substrate here is you've got plaque. Okay, sometimes this plaque doesn't cause you any chest pain at all. It will be sitting there and it's silent. Then one day it just develops a crack. Okay, it ruptures. Okay, we call that plaque rupture. So when a plaque ruptures, what happens is the body tries to seal off this plaque because the body doesn't like seeing all this hidden there. So it tries to seal off, but it's sealing off in a teeny tiny blood vessel that at most is 3 millimeters. If you form a clot within your vessel and occlude the vessel, that means the muscle which was supplied by this vessel starts dying. Remember, the heart is not like the skin or the nails where the heart muscle cells grow back. The heart muscle cells, once you lose them, they're gone. It will be replaced by other cells that don't contract at all. Same thing happens in the brain when you have a stroke. So a heart attack is a catastrophic event where you rupture a plaque inside the vessel and then you form a clot. And if that clot doesn't dissolve, the muscle which is supplied by that vessel dies off. So in terms of presentation, of course, it's similar to angina type of pain, but more severe. Same description, central crushing chest pain there in the middle of the chest. It can go to both shoulders or the left arm. It can go to the neck or behind the ears, sometimes stomach pain. Unfortunately, some patients can come with a cardiac arrest. That means that the clot formed in a vessel which is very big or just towards at the beginning of that vessel. So those sudden deaths that you hear about, most of them are because of those catastrophic events. So in terms of knowing, usually, like I said earlier, men and women may have different symptoms. Of course, chest pain is common to both of them, but you have to look for the unusual symptoms as well. A cold sweat, nausea and vomiting, feeling very full from nowhere. It's coming and going, coming and going. At some point, what the heart attack does is the pain might start, then go away, start again, go away, and then there'll be a point where it will be continuous. That means that at that point, the vessel is completely closed. If nothing is done about it, that muscle is going to die. Okay. So if someone has a heart attack, how do you help them before you take them to the hospital? What you can do is you have to identify the symptoms. The symptoms that I've talked about, you need to keep it at the back of your mind. If you see something unusual, try to identify the symptoms. So just a reminder, central crushing chest pain, you find someone gripping their chest, like they'll tell you like something is sitting on their chest. That's very classical. Or these other symptoms that we've talked about. And of course, some unusual symptoms. Of course, it's not easy at home to identify all this, but if something is just not making sense, you have to seek for help quickly. In the meantime, what you can do is sit the patient down, make sure that their legs are propped up, like you hug your legs to your chest. And then if you've got aspirin somewhere close by, you give them, usually the aspirins in the homes are those little 75 milligrams. So give them a total of 4 tablets to make 300 milligrams and then rush to the hospital. If someone stops breathing, because remember, sometimes a heart attack can come as a cardiac arrest, you have to learn how to do what we call CPR. This is another topic for another day, but it's very important that everyone knows this skill. It's life-saving. Of course, this patient has to be taken to the hospital because if the vessel is closed, the only way that blood can be restored to the part of the heart muscle that is starving is to open the vessel, either by medication or opening it mechanically in a cath lab. So please, all patients that, or everyone that has that type of symptoms, rush them to the hospital. Do not wait. Don't start giving antacids or Gaviscon or all sorts of things because you're delaying. The heart only has about 12 hours before the muscle completely gets damaged. So if we miss that window, then there's nothing we can do to salvage the muscle that's dead. So you find that if someone had symptoms yesterday and then you bring them late, there's not much that can be done to restore the blood flow. It's like someone has had a stroke and they were kept at home, and then when you bring them to the hospital, nothing much can be done to restore that. So at the end of the day, it's about timing. The symptoms start, make sure that you seek help quickly. Okay, so that's about it in terms of angina and heart attacks. I'll take some questions now.
Right. Thank you, doctor. So I've seen that we have a lot of questions, including myself. I also have a lot of questions. So here what we'll do is that doctor will take about less than a minute to run a message from our sponsors. As people are preparing their questions, please prepare your questions. We don't always get these kinds of experts on this platform. Please ask as many questions as possible. And today what we're going to do is that we'll let you ask all the questions. So a quick message from our sponsors, then we'll quickly get back to answering the questions.
What can you do with 5 kwacha? Not a lot. A 5 kwacha auto boost can get you 1,900 kwacha extra IO cover. Bernard Mulindu auto boosted, and Bernard received a total payout of 2,070 kwacha when he needed it most. Here is Bernard's story.
My name is Bernard Mulindu. I'm from Moto. Kairi hospital check. It's a 5 problem. 296 hash. Ngasanya kwa chat. Wamitumira kwa 2 pills. Kairi manda kusongera tukara mupradiki yako datawole bomba. Alipira kwa nabana kuma school. Wale bombenchi tulisuma sana.
Dial star 296 hash to auto boost and quickly grow your IO recharge with care cover each time you recharge. IO together with MTN. IO, because you care.
So, welcome back. And Dr. Kawa is still here with us. Don't worry, she hasn't gone anywhere. So now let's see what questions you have. Well, I had my own questions. It felt like I was in class. And thank you for the presentation, Doctor. It was very clear. Now, I need you to clarify one very important issue here that you raised. It's the issue of sexual boosters like Viagra. I'll also add Tototo and all these other things that men like to take. You said that when men take Viagra, they should declare, if a man comes to a hospital with the signs and symptoms of heart attack, they should declare that they're either on Viagra and Tototo. I want you to go back to that and just make it very clear so that everyone is either clear on that point. Doctor.
Okay, thank you. So Viagra and these erectile dysfunction drugs works by dilating your blood vessels. Okay, so remember what I said about the drugs that we give for angina pain. We give nitroglycerin, the same thing that the same function that Viagra does. Okay, so if we give you double nitroglycerin, then you are taking everything double. So the BP might drop to such drastic amounts that your heart eventually starves of oxygen, and that may precipitate a heart attack. So if you're taking any of these drugs, you have to tell us so that we give you an alternative and not the nitroglycerin.
All right, Doctor, let's take questions from our audience. I had a lot of questions for you, but I think that I can ask you my questions later. Let's take as much questions as we can from the people who are following the conversation. So there's Susan Mukonka here. Susan wants to know, is aspirin good for angina? I was advised to drink aspirin when I had that.
Okay, thank you, Susan. So in addition to the nitroglycerin and the atenolol that you saw that we give for symptoms, we also give certain medications for prevention of either formation of a clot or for prevention of that plaque which was inside your blood vessels from becoming bigger. So obviously aspirin is one of them. Aspirin, is a mild type of blood thinner. And if it happened that, for instance, one of the plaques ruptured, then we hope that the aspirin will work to prevent the clot from forming. Other drugs that we give are cholesterol tablets. They are not only meant to lower the cholesterol, but they make the cap that hides that plaque from the blood to become thick so that it doesn't crack. Remember what I said about a heart attack? It comes because the plaque cracks. That cap that sits on top of the plaque cracks, and then a clot forms on it. So we give the cholesterol tablet to make the cap thick. Of course, there are many other drugs that we give as prevention for either a heart attack or from having the plaque grow bigger. So aspirin is one of the backbone therapies for angina is.
Right. Let's see what other questions we have here. Okay, there's this question here. Let's see. This is Maureen Banda. Maureen Banda is saying, my husband has angina, and every time it's cold, he has to put on warm clothes. He always have chest pains. What really happens, doctor?
Okay. So remember what I said about some of the triggers of angina. Angina will be triggered by anything that increases the amount of work your heart is doing. So obviously when it's cold, you have to keep your metabolism high and the heart is overworking. So I'm pretty sure that it's not only coldness that your husband feels a chest pain too. If you're very attentive, he might describe that he gets chest pain even when, for instance, he climbs a flight of stairs. So I think in that instance, then he needs to come in so that we do the evaluation. Like I said, some forms of angina can be managed just with medication, like any chronic illness like BP and sugar and so on. But there are certain forms that require urgent attention, especially if the plaque forms very close to the beginning of the vessel, because then it puts you at high risk of other bad events.
So, Violet Mwanza is asking, I always feel pain coming from the heart, and I have tried a lot of medication, but nothing has changed. Could it be angina or something else?
Obviously, it depends on what brings on that chest pain. It will have to be described. So how does that pain come? Is it a classical story of angina? How long have you had it? Are there any associated symptoms? So to answer those questions, obviously, you need first a good history to classify the type of chest pain. What we encounter most of the time is a lot of these chest pain syndromes, especially in female patients, where they have chest pain just below the left breast. Very common. Sometimes it goes to the back. So sometimes these pains, remember, the chest has lungs, it's got the spinal bones, it's got the breastbone, and part of the stomach actually sits above. So what would happen is if any of these structures, for instance, is inflamed, you're going to get chest pain. Most of the time in women, I think what we find is back pain that comes to the front, in which case you need to check your bra size, your posture, and so on. So of course, it depends on the type of chest pain you're having. If it's pain because of a muscular problem, then it's correctable by exercise, physiotherapy, and so on. But obviously, we want to rule out the bad thing. So first, we make sure that your heart is okay, and then we send you on your way if it's not the heart.
This question, doctor, I think this is probably one of the common questions even I have received because of this COVID issue. This is Miles Zuru Muke. Her question is, since I suffered from COVID-19, I ran out of breath. What could be the problem? But I also have high blood pressure and diabetic.
Okay. Thank you, Miles. So COVID causes a lot of problems. Primarily, it likes to cause problems to the lungs. So depends on the extent of your COVID infection. How was it the time you were ill? Did you require hospitalization? Did you have COVID pneumonia? If you had COVID pneumonia, it leaves certain scars in your lungs that reduce your lung capacity. So that shortness of breath can be anything. It can be because of a COVID lung, or it can be because your heart function is affected somehow. Obviously, COVID also has an effect on the heart. It can cause, for instance, inflammation of the heart muscle, so we call the myocardium, or it can lead to inflammation of the lining of the heart muscle. In some people, it can cause blood clots, but of course, if it has caused a blood clot, that's a heart attack, which is totally different from what you're describing. So depends on how bad your COVID infection was. If you had COVID pneumonia, then those residual symptoms are because your lungs still need to readapt. It takes a bit of time to resolve. Of course, it depends on how bad it was.
This is a very interesting question, doctor, very clinical. Jamal Abdul Aziz, he says, I was found with thickened left ventricle walls and my LDL was 5.13, and I was given tell my age, Nebivol and rosuvastatin 10 milligrams and aspirin 75 milligrams. My question is, how long should I take this medication and when can I go for LDL test and the left ventricle? And can the left ventricle be reversed?
Okay. So, Jamal, it sounds to me that like you may have hypertension, that's one. So that might be responsible for your left ventricular hypertrophy. Remember what I described? The left ventricle becomes thick because it's pumping against a high pressure. So that's the purpose of that Telma H. It's to lower your blood pressure. So obviously, like any muscle, if you detrain, the muscle becomes smaller. So if your blood pressure becomes controlled, then the thickening of the walls also goes back. We don't want to reach an extent where it's irreversible. So obviously, when you can, you have to take your medications, and unfortunately, it's for life. If you're diagnosed with hypertension, the medication is for life. And then on your LDL cholesterol, that's extremely high. Remember, cholesterol has a lot of nieces and nephews and cousins. So the LDL, if for everyone else, if you take a lipid panel, what we call a lipid panel, they'll give us your values first for your total cholesterol, then there's LDL, there's HDL, there's triglycerides, and so on. You should look at the number LDL. That's the bad cholesterol. So that cholesterol should be less than 3.4 if you've never had any heart attack or you've never had anything else. If you've had a heart attack before or angina, your value is even lower. It has to be less than 1.8 because the LDL cholesterol is the one that goes to sit inside your blood vessel and cause plaque and then cause angina and then heart attack and so on. So that rosuvastatin that you were put on looks like a small dose to me for that level of LDL. It has to lower the LDL. In addition to that, you need to help it along by eating healthy and exercising and changing. I don't know how your lifestyle is, but obviously you have to do a lot of lifestyle modifications to change. But looking at that value, you might have a familial issue with your cholesterol. So check around with your family members and see who has reported similar values.
Now, Doc, I know in your presentation, let me take advantage of this question. You talked about people regularly checking their cholesterol. I need you to repeat that point and emphasize on it because I think people may have missed it when you said it. because I'd like to mention that on this page, we've been running a campaign to encourage men to check to encourage people, not just men, people generally to go out and check their cholesterol. So just maybe if they hear it from you, they will be encouraged to continue doing this.
Okay. Yes. So my advice is for men, once you clock 40, you should start getting your cholesterol checked once a year. Remember the risk factors, men get coronary disease earlier than women, but of course that doesn't exempt women. After the age of 45, you also need to start getting your cholesterol checked once a year, and you'll be given the figures and the targets and so on. If there's anything that you need to change, it can be changed. If we can do lifestyle modification, we'll advise you as such. So it's not only for cholesterol. You have to get into the habit of checking your blood pressure at least once a month. Just know your numbers. Check your sugar twice a year. Know all those numbers. All those are important. And of course, in addition to that, you have to adapt to a lifestyle that won't put you at risk of developing coronary disease. We've talked about weight. We've talked about controlling your sugar. We've talked about shisha smoking and cigarette smoking and treatment of BP and so on. So all those things have to be done.
Okay, now there's an interesting question here, Doc. This is coming from Chilufya Chanda. How about angina originating from mitral valve prolapse? So I think he's talking about chest pain. Chest pain yes. From mitral valve prolapse. How different is it from angina?
Okay. What I've noticed in my practice is most people have been misdiagnosed to have mitral valve prolapse. I've had to discharge a lot of people. Mitral valve prolapse is a very specific diagnosis, and it's quite clear on echo. And the presentation is not usually chest pain. They come with valves that are leaky, and sometimes they can get arrhythmias. So we see a lot of especially young patients that have a diagnosis of mitral valve prolapse and these non-specific chest pains. But angina pain is not what I think you've been told in terms of your diagnosis of mitral valve prolapse. I don't know how your diagnosis was made and how it was graded, but mitral valve prolapse doesn't come as angina pain.
Okay, I'll tolerate this question from this lady purely because we are talking about mitral valve prolapse as well. So I'll take this question. Doctor, is it safe for a woman suffering from mitral valve prolapse to conceive and carry a baby to full-term pregnancy? Of course, notwithstanding the fact that maybe she was also misdiagnosed. But let's assume she was correctly diagnosed. I mean, of course, she would have to confirm the diagnosis. I hope it was confirmed. Yeah, go ahead, Doctor.
Okay. Yes. Okay. So if you have a true mitral valve prolapse, it depends on what it has done or how it's behaving. So a mitral valve prolapse is essentially a heart valve which is spongy and quite loose. So it can't form a proper seal such that it leaks backwards. So if that leak, or we call it regurgitation in medical language, if that leak is severe, then it can compromise your heart function. So if you've got what we call severe mitral regurgitation from the mitral valve prolapse, then pregnancy is not a good idea. But of course, we would need to know how you were diagnosed once again. So only if you have severe valve leakage from the mitral valve prolapse should pregnancy be held off. Until, of course, you get treated, and in which case would advise you whether pregnancy is still a good idea or not.
Excellent. Here's another question for you, Doctor. This one is from Zewelanji. I'm an angina patient. What is confusing is that each time I have an attack, I'm given different types of meds. Sometimes I feel frustrated and I don't go to the hospital as I feel like the doctors do try and errors. Kindly advise on the recommended treatment for angina.
Okay, so thank you. So angina treatment is very straightforward. If you've got true angina, then the treatment is as I've described. First, we give you medication for symptoms, And most of these are the nitroglycerin and the beta blockers. There are a few other medications out there. And then we give you medications for prevention. If your symptoms are not controlled on those medications, then we have to go and physically look to see how bad the angina is in terms of the size of the plaque, in which case you need what is called a coronary angiogram. But of course, to undergo that test, you need to have a subjective documentation of how bad the angina is. And the only way to do that is to exercise you. So we put you on a treadmill, we do the ECG, and we see how your heart responds. If you've got severe response, then we take you to the cath lab and check. And then if the narrowing is very bad, we mechanically fix it with a stent or with surgery and so on. So I'm not sure how your angina was diagnosed and if it's actual angina, but those are the steps. It's a very straightforward thing. There's no sort of two ways about it.
So basically what you're saying is that her complaint where she says every time she goes back, she's given different medication. That's not standard practice, is
it? It's not standard practice, no. So
So
obviously you want to start with the baseline medications like the backbone. Then you add on, if the usual medications don't control symptoms, you add on. But obviously you don't want to wait until someone is taking 5-10 medications. You need to get proper documentation of how bad their coronary disease is. And the only subjective way of doing that is to put them on a treadmill or put them on a bicycle and see. It tells, it's very clear. You'll see it, and once you know the patient falls in this category or not, then you decide what to do after that.
right. Excellent. Now, Chipego. Chipego wants to know, I know you touched on this in your presentation, but maybe make it, either repeat yourself or make it more clear. How different is angina chest pain from acid reflux pain?
Okay. So sometimes acid reflux, it can be confusing to distinguish because, like I said earlier, in some people it can just come as acid reflux. It's they get pain in the stomach. So in terms of acid reflux, obviously it responds to antacid, or it usually responds to antacid. Angina type chest pain won't respond, and classically it would come when you're doing something that is causing your heart to work more. So acid reflux like to come after a meal, or when you lie down, or when you eat certain foods, and so on. Angina pain comes differently.
Another very interesting question here, Doctor, from Kakweji Jitanda. Kakweji is asking, Doc, I normally experienced heart palpitation. I went to the hospital, did the echo, and I was told I'm fine, but still I feel the palpitation. Can it lead to enlargement of the heart?
Thank you, Kakweji. So palpitations won't be seen on echo. Palpitations might be seen on ECG if at the time you're doing the ECG you have the palpitations. But the only way of knowing what type of palpitations you're having is to do like a long-term ECG. For instance, you wear, depending on the frequency of your symptoms, you do what is called a Holter ECG. You can wear the machine for 24 hours. Sometimes you can wear it up to 7 days, in which time the machine records your heart throughout, such that when you have the palpitations, it records what they actually are. So, of course, palpitations mean there's an electrical problem on the heart. Some of them are innocent, and some of them require aggressive therapy. So we won't be able to tell until we do that test and see the actual type of palpitations you're having. In terms of causing enlargement of the heart, again, it depends on the type of palpitations you're having. There are those that are incessant. The heart doesn't like beating very fast. It has to beat between 60 and 100. If you're always above 130, 140, very high heart rates, it gets tired and it remodels and changes and becomes weak. So obviously, if you're having incessant palpitations, they need to be investigated, and then they need to be kept quiet so that they don't interfere with the function of your heart.
Okay. There's Hakwenda Bene Felicitas. So her issue is that she's a BP patient or hypertensive patient who is experiencing burning feet and pain from the back to the hands, and sometimes her hands get swollen. What's the issue there?
Okay, so for burning feet and on the hands as well, sounds like what we call peripheral neuropathy. That's a nerve problem. I don't know if you're diabetic too. We don't really get a lot of peripheral neuropathy in hypertensives, mainly in diabetics because of damage to the small nerves, hands and feet. But if you're getting pain in the back as well, sometimes it can be because the backbone, the big bone, the spinal bone, you can have what is called spondylosis. So sometimes you get compression of the nerves in certain areas, and that can cause pain in the arms and tingling and all that burning pain. So I suggest you go and get your sugar tested, not just the random sugar, but do what is called the HbA1c. That's a more subjective measurement of whether you're diabetic or not, just to put that out of the way. Of course, there are a lot of things that cause peripheral neuropathy, but sugar is the commonest.
Right. We have Homily Mumbi. Homily Mumbi, her question is a doc. I'm an angina patient and on treatment, but recently I was diagnosed with COVID pneumonia, was commenced on aspirin 75 plus colchicine. But of late, the pain is not reducing. What could be the problem?
Okay. So the colchicine obviously was started if you had what is called a high CRP. Remember, COVID causes a lot of inflammation. So if you have a high CRP, we put you on colchicine for a while. If you have actual angina and the pain is not reducing, then it's time for a recheck to see if other medications can be added on top of what you're taking now. You've only talked about aspirin. Are you on a nitroglycerin? Are you on what is called a beta blocker? So if you're not on any of those drugs and it's actual angina, then you're not receiving adequate therapy for the angina. Remember, aspirin is just to prevent blood clotting. It doesn't do anything for the chest pain. What helps with the chest pain is the nitroglycerin and the other drugs that I mentioned earlier.
Right. So basically what you're saying is that the drugs that she's on don't suggest that she actually has angina anyway. It doesn't sound like she's being treated for angina.
No, unless she gave me another list of drugs, if there are other drugs that she's taking.
Oh, so there's a possibility she could have left out some drugs. So, Doc, there's this question here. Does angina attack cause someone to collapse? My sister always collapses, and when we take her to the hospital, they always say the valves are closed because of cholesterol or too much fat. Can angina be the cause of the chest pains?
There are a lot of conditions in that question. So if they've told you that the valves are closed and your sister keeps on fainting, then that's severe. What usually causes fainting in terms of valve problems is when you have a problem called Iotic Stenosis. It usually it's a valve that it connects the one of the chambers of the heart to the big artery that takes blood to the rest of the body. So if that one is severely narrow, then someone can collapse, especially if they exert themselves. And because the valve is narrow, obviously it causes a lot of pressure in the chamber of the heart, and the heart muscle becomes thick, and that can cause angina as well. So I don't know what valve problem you've been told your sister has, but if it's aortic stenosis, from the sounds of things, it's very severe and it needs to be taken care of.
Right. So you were just responding to Homily. She's come back with a comment that those are the drugs she's on. So it looks as though she's actually being treated for angina, right?
Angina. Okay. Then she needs to, I don't know if she's been put on a treadmill before. She needs to come so that there's subjective assessment and we get the story properly.
Right.
Yeah, because like I said, most of the pain is non-specific, and you find a lot of people are put on angina medications when it's not really actually angina. There has to be a subjective, an objective assessment. You have to prove that the pain that you're having is actually your heart muscle starving of oxygen, and there are tests
Right.
that can do that.
Excellent. There's this question here, doctor. My heart pains like there is a wound. What could be the problem?
Okay.
Kuri
It
chironda
depends
kumutima.
on how long have you had it? Is it your whole life or it just started and so on? A lot of things can cause the heart to pain. Angina and heart attack are the two that we've talked about. Sometimes it can be inflammation or swelling of the lining of the heart, or sometimes it can just be inflammation of the muscle that overlies the heart.
Or
So
a
obviously it
boyfriend.
depends on, indeed. So
Can a boyfriend cause the chironda kumutima?
of course, the heart overworks when you produce all those stress hormones. So it can even precipitate a heart attack. Remember, stress can do it. So that's one way to go.
Yeah. Go on, doctor.
Yeah, so difficult to classify the wound. Yeah, I would need to hear the story.
Okay. Let me see. Okay, this one, let's make this one our last question because I think we're almost getting to the end here. What exercise do you recommend to avoid most of these heart conditions, including angina?
Longer. All right, thank you. Very good question. So, in terms of the exercise, it's anything that keeps you moving. We start from just general walks. The usual prescription we give is at least have a total exercise time of around 150 minutes a week. So it depends on how you divide it. You can divide it into 30 minutes or 1 hour, you do the whole thing. But minimum 150 minutes a week. It can be walking, it can be jogging, it can be anything. So what I advise is, of course, walking and jogging is aerobic exercise. Although aerobic exercises, you need to combine your aerobic extra exercises with strength training. It's very important. So if you walk a lot or you're a runner and so on, combine that with a bit of strength training, like lifting just, some weights or doing squats or using just your body weight to build a bit of muscle. So you have to combine the types of exercises. But at the end of the day, it's anything that keeps you moving. Okay. So if you've got, for instance, pain in your knees and so on, if you're a swimmer, take up swimming. If you can't walk faster, you can carry a couple of weights and walk with them. In which case, your hands are exercising if your legs can't take you as fast as you would want to be. Yeah. So anything that keeps you in motion is good, and do it as much as your body allows you to. If you've got no underlying condition, just go for it. The fitter you are, the better it is for the heart. Remember, we said the heart is a nice, pliable muscle. It needs to relax nicely to fill up with blood. So if you keep yourself fit, then the heart is happy that way. The blood vessels become bigger, your BP drops, and so on. So exercise is good.
Excellent. Doctor, I would like to thank you for coming and I would like to thank you for being here with us today. Um, what's your take-home message? We had a very stimulating conversation, and on behalf of the people who follow this page quite actively, we would also like you to tell us whether if we invite you next time you will come or not, because it appears people are already suggesting topics for you. So what's your take-home message? Someone was also asking where are you found, and also tell us if we invite you whether you would come back or not.
Okay. Yeah, no, if you invite me, definitely I'll come back. Just choose a nice topic for me. Um, in terms of where I'm found, I'm now currently at the National Heart Hospital. That's the main referral hospital for cardiac patients. So that's where I'm found. What was the other question?
What's your take-home message on this topic? What should people not forget?
Oh, okay. So you need to look out for the typical symptoms of angina, typical symptoms of a heart attack. If a heart attack happens, please don't keep someone at home. Rush them to the hospital, and so that they get proper therapy. Of course, uh, most people wouldn't know about angina and heart pain and so on. So it gets mistreated a lot. But what happens is if you have a heart attack, for instance, and it's not treated properly and that muscle dies, those are the patients that end up with heart failure, and heart failure is a bad condition to live with. So the important thing is for you to identify the symptoms and seek help. And then two, keep yourself healthy. Avoid those habits. Shisha smoking, especially. I mean, it's just out there. It's so much, and people think it's harmless. It is. It's not harmless. What you should know is even smoking one cigarette can trigger a heart attack. So you don't have to smoke for 10, 20, 15 years. Even that one can cause damage to your blood vessel and cause a clot to form there. So get rid of the habits that are not necessary. Yeah, and just keep healthy. If you don't keep healthy, then you'll be my customers.
Doctor, thank you very much for coming, and we are very grateful on behalf of this community and on this page. We really thank you most sincerely for making the time. And also, please convey our gratitude to your family for allowing you to share this time with us. We are most grateful.
Thank you so much. Thank you for having me.
All right. So there you have it. And we had Dr. Loretta Kabwe talk about angina. Please, as usual, do share this video as widely as you can, because it's important that, you know, everybody out there gets this information. It's not every day that we get such experts to come to you on this platform and explain these important topics and these symptoms that seem to affect a lot of people. So go ahead and share this video. It's the least you can do for us. Please share it as widely as you can. Until next time, do take care.
IO is easy, and to sign up is just as easy. Meet Abel Mutula from the barbershop in Kalingalinga. Abel Mutula is also an IO customer.
My name is Abel Mutula. Signing up with IO was easy. This is how I signed up. Step 1, dial *296#. Step 2, select 1, sign up. Step 3, select either 1 for my hospital or 2 for my life. Step 4, fill in your age and confirm. Step 5, select 1 to accept the IO terms and conditions. Well done, you signed up. Now let's add my loved one.
IO together with MTN. IO, because you care.